Welcome back. I hope you enjoyed the lunch, the networking, the afternoon sessions, and the coffee break. So I remind you that later on, we will have some rapporteurs for each one of the parallel sessions, and there will be opportunity to learn what has come out from this session and also from the ones that you were not able to join. So please stay with us. But now it's time for the second round of the pitching competition, whose title is Facilitating Evidence-Based Policymaking. So here we will deal with MSCA projects that have a component of dissemination and exploitation of research towards policymakers, policy stakeholders in general, okay? So let me remind you the dynamics, especially to the candidates. So there will be 3 minutes of pitch, followed by 3 minutes of question-answer with the jury, okay? And I remind everybody that there is a QR code for a Mentimeter vote in which you will need to vote each one of the candidates. Bear in mind, because we have received questions in the coffee break, that there is one Mentimeter code for each one of the rounds, okay? So you really need to vote now, I mean during this round, because you will not be able to vote again at a later moment for the candidates, okay? So be very careful and aware that you need to answer now. So let us start with the first candidate. Exceptionally, due to health reason, the first candidate was not able to join us personally, but she will join us remotely online. So she's called Cristina Infanti. She's an MSCA research fellow at the Center for Physical Activity Research at the Rigshospitalet in Denmark, and her pitch is called Exercise Prescription in the Treatment Guidelines of Cancer Disease. So let's welcome her.
Are the two most important predictors of mortality. It is our ability to consume and utilize oxygen, or what we call aerobic fitness, and it is also our muscles. They both decrease with age, and they both decrease in cancer disease. This is Leo. Leo has been diagnosed with metastatic colorectal cancer, has undergone surgery, and receives chemotherapy. Following this treatment trajectory, patients like Leo will get physically deconditioned, get tired, weak, and very often not able to perform their daily activities. And why is that? Because 3 months of chemotherapy decrease aerobic fitness and muscle mass to the same extent as 10 to 20 years of aging. And the same goes for other systems like the immune system, which are vital for cancer disease. Therefore, the purpose of our work is to counteract these detrimental effects. And we do that with exercise, because exercise is the only means that can increase aerobic fitness and muscle mass. We use different types of exercise, different durations and doses of exercise, and we test the effects they have on the different organs, as well as on the tumor itself. And we try to identify the optimal exercise protocols in order to maximize these effects, with the overall goal, of course, to increase quality of life of these patients and prolong their survival. But we're not restricted in the laboratory. We want to translate these results into healthcare guidelines. Therefore, we communicate our research to all levels of society, to the general public, healthcare professionals, but also to policymakers. For example, we have developed the CIFAS Ambassador Program, an educational program for healthcare professionals, medical doctors, physiotherapists, who are informed about the latest policies regarding exercise and disease prevention and rehabilitation, and that they can then implement these policies into their organizations. We often serve also as advisors to the Ministry of Health when it's about policies related to exercise and health. Our research outputs are also part of the official guidelines that exercise oncology agencies publish. Now, what is left is for these guidelines to be translated into policies so that exercise can be prescribed alongside the pharmaceutical treatment of patients with cancer. Because when that happens, patients like Leo will have a better and longer life, And I'm pretty sure about the better part, because every time I ask my patients if they feel that exercising has been good for them, the only answer I get is yes, yes, and yes. Thank you very much.
Thank you, Christina. And now one question from the jury. So from Antonio Mas. Now a microphone will come. Perfect.
Thank you so much for your work and for your presentation. Congratulations. It's amazing work. My question is about if this work could be useful for other diseases other than cancer.
Yes, definitely. And we do that in our center. We are working with different types of chronic disease like diabetes, COPD, obesity.
Okay, great. So thanks a lot for your presentation and for your answer, Christina. That's one last applause. And now we go back to the in-person pitches. So the next candidate is Aisha Futura, MSCA PhD student at the University of Latvia. And her pitch is called Linking Science and Policy to Promote Children's Language Development in the Digital Age. Welcome, the stage is yours.
Thank you for the kind introduction. I'm just waiting for my slides to load or to appear. Oh, it's me. Okay. I want you to take a moment and think back at your own childhood and what you were doing while your parents were busy cooking or having important phone calls. And compare these experiences to children today. You will see children nowadays are part of an ongoing natural experiment surrounded by all kinds of digital devices and gadgets that can either act as their tutor, their friend, or their babysitter. While these devices undeniably have advantages, like allowing children to learn a new skill, they also come with some concerns. Crucially, how these devices might influence how children learn language. And indeed, a large-scale study with over 2,000 infants and toddlers in more than 12 different countries have looked at the relation between digital device use or screen time and language outcomes. What they have found is that screen time had a negative impact on language skills, especially in children from disadvantaged families. And why is that so important? Language skills have a far-reaching and long-lasting impact on a child's educational and employment trajectory. For instance, a child with insufficient language skills at age 5 is more than twice as likely to be unemployed at the age of 35 compared to their peers with proficient language skills. And so it becomes evident that we need to empower parents and caregivers, as well as educators, to harness the power of technology and at the same time minimize its potential harm. And how do we do that? To date, policymakers have struggled to come up with clear and easy-to-action guidelines for parents, caregivers, and educators about children's screen time and their language development. What is needed is a translator between the world of facts and numbers and the world of policy. And that's where we come into play. That's exactly what we did. With our contribution, we transformed complex research findings into actionable guidance for parents, educators, and policymakers. The result of this effort was an openly accessible 3-minute video titled Screen Time, What, When, and How. With this, we provided a blueprint how science and policy can work together and scientific evidence can have an impact on policy and everyday practice. So here I want to give a big shout out and thank you to my amazing colleagues who contributed in this project, and feel free to scan the QR code to see the video. Thank you.
Thanks, Aisha. One question from the jury. Okay, Antonaita.
Thank you very much, and many thanks, Aisha, for this very interesting presentation and your important research. You've mentioned guidelines, and you have worked on them together with a team. Could you please tell us whether these guidelines have been applied, tested in real settings, and if so, what were your observations? Thank you.
Thank you for the question. So the 3 tips that you could learn from our video are based on guidelines, general health guidelines from the WHO, as well as intervention and observational studies. So there is strong scientific evidence backing the claims and the tips that we provide in this video.
Thank you.
Great. Thanks a lot. Thanks.
Thank you.
So the next speaker is Larai Dianagwani, MSCA early stage researcher at Guy's and St. Thomas NHS Trusts in the UK. And her pitch is called Multi-Sectorial Approach in the Fight Against Sickle Cell Disease, Policymakers, Community, and Schools. Welcome.
"4,000 babies are born with sickle cell disease in Kaduna State. And unfortunately, less than 50% of those babies live past their 10 years birthdays. Sickle cell disease is a genetic disorder where the patients inherit sickle genes from both parents. And some of the symptoms include anemia, extreme pain, swellings on the joints, and even childhood stroke. The Africa Research and Innovative Initiative for Sickle Cell Education is a multi-sectoral research collaboration, and it aims at staff exchanges, international staff exchanges, and multidisciplinary staff exchanges. It is aimed at improving lab diagnosis, genetic counseling, and also developing an implementable treatment protocol. ARISE is also aimed at research in implementation science and the newborn screening pathways. Studies have shown that if the disease is detected early, it means you can improve on the patient's health care by introducing them to the pathway of care early and providing necessary prophylaxis that will improve on the patient's life and mortality and morbidity rate. That's why at ARISE, we have been engaging with policymakers in Kaduna State, having already signed a memorandum of understanding with the state government to establish the newborn screening of sickle cell disease in Kaduna State. We are not unaware of what is the people's belief in local communities, whereby they believe that sickle cell disease is an act of witchcraft due to superstitious beliefs. And that is why we also engage these communities through their strategic stakeholders, like the chiefs and the religious bodies, to create awareness on sickle cell disease and the newborn screening. Because if these parents allow for their newborns to be screened at birth, they're giving them a better chance to health care. And in closing the gap, ARISE has also gotten approval from the state government to train students in primary and secondary schools on knowing their genotypes, because they need to understand that if they have the sickle gene and they choose a partner that has a sickle gene, there is a greater likelihood that they're going to born sickle babies. Thank you.
Thanks, Larai. A question from Graham.
Thanks, Larai. And I find it really inspiring what you're doing. And I know that half of all babies with sickle cell disease are born in Nigeria, in the whole world. Yeah. So what's your plan in terms of convincing local governments? You've written extensively about working in a patriarchal society. What's your plan to convince people to roll out screening widespread in Kaduna State?
Our plan is first to make them understand that it's not a death sentence per se, and also with the right health care, these babies can have a shot in having a better life. And it's not just the newborn screening, it's enrolling them into the pathway of care early. And our involvement with policymakers will be for them to also have a budget line that will cater for, even if it's a subsidized means of treatment for the patients of sickle cell disease.
Okay, thanks a lot.
Thank you.
Next speaker, Victoria Gorbunova, from an MSCA postdoctoral fellow from the University of Luxembourg. 5 steps to bridge the mental health gap. Welcome.
In 2015, while being a psychotherapist, I went through depression. I couldn't get a grip on my life. I crying while walking through the streets or sitting in my office. It was a severe case, but no one believed me. Even my friend, an experienced psychiatrist, said you function well. I did, but through daily struggles. Eventually, I got out with support, but first, with acknowledgement of the problem by people around me. My experience is not unique. Invisible disabilities. It's a common name for mental disorders. Depression, anxiety, and others are often unseen even to professionals until they result in severe impairments of functioning. I'm not mentioned before, I'm Ukrainian. Due to Russian aggression, constant military threats, and daily attack, more and more Ukrainians experience mental health deterioration, invisible deterioration. What can we do? To train more psychiatrists? To have mental checks, regular mental checks everywhere? Yes. But is it effective and cost-effective? No. To bridge the gap between people's need and accessibility of care, we need what helped me and others like me. We need people around capable of mental health support and referral. We need what WHO promotes, task shifting, partial distribution of care to non-health professionals. To do that, we developed universal mental health training, educational program for frontline professionals. It's evidence-based and specialized, and it trains police officers, emergency responders, social workers, pharmacists, teachers, and others who daily interact with many people in 5 relatively simple but highly important steps. To recognize mental health condition, validate condition with a person and decrease the stigma, give support and hope for the better quality of life, refer for professional help, and ensure that this reference was successful. For now, Ministry of Health and Ministry of Veterans have approved the program. And now we are doing efficacy and feasibility research for preparing the training for national and international rollout. What do my team and I want for planets and Ukrainians in particular mental health? victory and peace. What do? We empower policymakers with the instrument capable of making mental health everyone's business. Thank you.
Thank you, Victoria. Question from the jury? A question from Antonetta?
Yeah, thank you very much, Victoria, for this presentation. Really a very important topic. We all indeed want victory and peace. And my question to you, you already shared with us all that your model and your work actually will be taken into account and used by the Ministry of Health and Ministry of Veterans. My question is about embedding this model also in the training of teachers and educators. Do you have any plans to do so in order to maximize its effect? Thank you.
Thank you. It's very deep questions because stakeholders' engagement, I guess, is one of the most important things to make something really successful. And we already have collaboration with biggest in Ukraine NGO, Smarta Svita, and they already launched the training for our teachers based on this model of universal mental health training model to teach our teachers. And we have already 2,000 of trained teachers to give support to children with the help of this model, to recognize, to validate, to support, to refer, and what is like last but not the least, to make sure that reference was successful, that help was obtained.
Thanks a lot. Thanks. And last but not least, Jan Robiou-Dupont, MSCA researchers at Utrecht University in the Netherlands. His speech is From Policy Relevant Science to Strategic Climate Science Inputs. Welcome.
Imagine a big cake, but we're several people around the table and we all really want some. Should we share equally? Should we give more to the smallest person who's growing up? Or to the person who's starving? Now imagine that the strongest person already ate half the cake while we're discussing all this. How do we share what's left? Well, the cake I'm really talking about is the emission space remaining for the world to achieve the Paris Agreement goal to stay below 1.5 degrees of global warming. The question I'm asking is, how much should each country reduce their emissions? To answer that question, we modeled equitable emission scenarios for all countries to align with the Paris Agreement and its equity principles of historical responsibility and financial capability. Here we can see that even the revised EU emissions target is insufficient to align with any of those trajectories. Then, in a later publication, we combined the different equity approaches to reflect the bottom-up nature of international relations and derive an ambition metric applicable to all. With that, we can say that the EU emissions target actually represents a fair share of a 2.5-degree warmer world only, far from the 1.5 degree objective. So then we made all this data available in a publicly available website called Paris Equity Check. But okay, we have, doesn't seem to work. Yeah, we have evidence. How do we make evidence-based decision-making now? Well, I try to engage with the different arenas where decisions are being made. Obviously, the first approach is to try to publish in high-ranking journal, have the results covered in world media and by the IPCC and UNFCCC reports that are whose goal is to inform decision makers. But while these reports have a very high impact, their mandate does not include to show national level emissions results. So we also inform international negotiations where emissions targets are being negotiated across governments. The Paris Equity Check website is widely used there. I've personally worked for a year advising heads of EU delegations. This year, a new study was used by a group of 58 vulnerable countries for their campaign on climate justice called Fair Share Now. Tomorrow I'll be speaking with the UN High Commissioner for Human Rights in a panel on how to link climate justice with human rights. Fortunately, we can also work for governments. The UK Committee on Climate Change has recommended a 2030 and 2050 target based on our study that the British government later adopted. But not all governments are listening. So I also write scientific reports to inform court decisions, including the European Courts of Human Rights and several litigation cases, and inform the judge on what are emissions level in line with the Paris Agreement. Some of these cases were successful, and some governments had to revise their emissions target to be more ambitious. But beyond the numbers, my message to decision makers is that ignoring fairness considerations does not make a decision neutral, it just perpetuates unfairness. Thank you.
Thank you very much. So there's time for one last question. Okay, Fernanda.
Thank you, very nice. If you could make your wish list to policymakers, what would be the priorities that you would ask them to address in concrete actions?
It's a difficult question in the sense that I provide numbers that are normative in the different arenas where they are used, whether it's international negotiations or court decisions, whether it's because they are meant to be fair or meant to determine what is adequate for a court. But I do not have the pretense that I can decide what is equitable. So my goal with this work is really to try to push governments and other actors, subnational governments, industries, to really engage with that question of fairness. And I find that usually the countries the least willing to engage with those questions are the ones benefiting the most from that unfairness. And there are other reasons than equity that blocks progress on climate change, but I think this is often used as a shield for inaction, and there are a lot of countries that could really do a lot more and would be willing to do a lot more if they looked at those questions, and that also goes for the public opinions that support these countries.
Thank you. It was a difficult question. You answered it well.
Thank you.
Thanks a lot. Thank you. Thanks. Okay, what a great second session. Really, I will go out of here with a lot of ideas and desires to change the world, because we have heard really from sickle cell disease to mental health, to from climate to language, really a brainstorming of very interesting ideas. So now you have your Mentimeter code here. Remember that you need to cast a vote for each one of the candidates to have your overall vote accepted, and that you need to do it now, okay? We will leave it for a couple of minutes more, because there will be one Mentimeter for each one of the 3 sessions, okay? So please cast your votes.